The key concepts that students learn in Therapist Module are taking the foundation components that they have learned in Introduction and applying them to a therapeutic model. This therapeutic model includes a full evaluation of an animal. Once they've understood evaluation techniques, then they learn how to turn that into a problem list and a treatment plan, and then they actually do treatments themselves. They practice modalities on dogs: electrical stimulation, laser therapy, pulsed electromagnetic frequency, and then they also get to do therapeutic exercise with the animals. So when they're doing the treatment plan, they're treating things that will actually help the animal feel better. So it's not just this idea of what therapy is, but they're actually in there in the trenches with their hands on the dogs, practicing the techniques that they'll take back with them to clinic.
We encourage students to attend the Therapist Module because, number one, it is extremely hands-on. Our students leave this course with strong manual skills, both in terms of evaluation and treatment, where we lecture and then we get immediately on the floor and practice what we've lectured about. I have a couple favorite labs in this class. One is the joint mobilization lab. At this point in the week, the students have really honed their manual skills and are able to really look specifically at how one bone moves on another in arthrokinematic motion of a joint. And it's quite a thrill for them to actually be able to look at and feel these motions and assess them and relate them to problems that they see farther on in their evaluation. In addition to the hands-on learning that we do in the Therapist Module, one of the great benefits is the collaboration of both veterinarians and physical therapists. It's a collaborative group that comes together bringing their particular backgrounds and expertise from a variety of settings. This increases the richness of the experience for our students.
So the diversity in the class of the veterinary mind and the physical therapy mind creates this depth of knowledge that would be missing if you only had one group or the other. The veterinarians bring the veterinary medicine component, which is the foundation of everything we do in rehabilitation. And the physical therapists bring this knowledge of how the body moves, anatomy, kinesiology. And so by combining those two things, you take medicine and you take it to the point where the animals are medically stable but have functional limitations. And then the physical therapists pick it up and say, our job now is to return these dogs to a higher level of function. And when everybody's in the room together and they've worked together for a couple days and start to understand that this is a continuum and we can't do animal rehab without each other, all of a sudden there's this fusion of minds. And PTs and veterinarians come together and become colleagues and friends for life because they understand how that collaboration will change their lives.
I would definitely recommend CRI to all of my colleagues. It's a top-notch program. The professionalism, the passion, and the knowledge of the instructors was really phenomenal, and they really get me excited about this field of canine rehab. And it also makes me feel really great that when I leave the classroom, that they will always be there for me as a support and a resource, which I think it's wonderful. And I'm already looking forward to coming back to take continuing education classes here. Really the best thing I learned from this Therapist Module was that it was so challenging and it was really fun because it really integrated everything I learned from the two previous modules. It really taught me to think critically about anatomy and how it relates to function and dysfunction so that I can really come up with a comprehensive assessment and the best treatment plan.
I would definitely recommend CRI to my colleagues, and actually I already have to one of my PT friends. It's a great course, you learn so much and they make it really fun. So the Therapist Module just included so much really good information, just all the different common orthopedic procedures and conditions and neurological as well. So it's hard to just pick one thing, but just generally how dogs can benefit so much from rehab. If it's a post-surgical dog or if it's just your typical pet, all of them, it's so common in people to have therapy that really it's just as beneficial, if not more, in dogs as well.
The main things I learned from the therapist module were how do you evaluate the dog's musculature. I'm trained as an orthopedic surgeon. We spent a lot of time looking at bones, a lot of time feeling joints, and I feel like sometimes we forget a lot of the things that are attached to those. So learning how to tell when they're tight, when they're painful, things that I think I often overlooked before. And also joint mobilization, a lot of techniques that I wasn't familiar with before. Yes, I would recommend CRI to my colleagues. I think it's been a very useful course for me. I don't think it's possible to learn how to take care of animals with just this course, which is why I think the model of learning rehabilitation therapy is a good one, where we take physical therapists from the human side and teach them to work on dogs, or veterinarians that already have experience with dogs, and teach them the language and the modalities of physical therapy. So I think it's a good model, and I think it's very useful in many aspects of veterinary practice.
Among many things, the main thing that I learned in this therapist module was this culmination of assessment leading to a problem list, and how all of these other parts to the dog become a primary issue to solve, not just the diagnosis. I would recommend CRI to anybody that I happen to have the pleasure to work with, to be able to take this culmination of excellent curriculum and hands-on activities and put it all into one collaborative environment between doctors and physical therapists. It's just absolutely invaluable.
I chose CRI because I'm definitely a hands-on learner, and I had heard from people who took the course that there was a lot of really hands-on training, and so that was like one of my top priorities when I chose, is that I really wanted to not only just learn it, but to be able to apply it when I went back into the clinic. What did I learn? I guess the better question would be, what didn't I learn? I mean, this course was just jam-packed full of really useful information, from doing more in-depth assessments to coming up with a problem list, figuring out how to kind of prioritize what you were going to treat and when, and how to kind of go through that treatment plan, what exercises to use, joint mobilizations. I mean, the amount of information was crazy, but I mean, it's going to be awesome. I would definitely recommend CRI to my colleagues. It's been a great experience, and the one thing I really regret is not doing it sooner.